Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, and welcome back to the Inspired Hygiene Podcast. Thank you all for following the podcast. We are in season 2. And season 2, the theme has really been about developing your Perio program in your practice. Really and truly, the Perio program is the core of what the dental hygiene department is responsible for in a general dental practice, really in any dental practice, whether it's Perio, pros, where any dental practice where they have a dental hygienist is really monitoring patients' health, identifying when there's active periodontal disease, and quickly recommending treatment to stop that disease, and then educating the patient on how to stay in a healthy position. So that really is the core of, what a dental hygiene department is all about. And again, I know I mentioned this a lot when you're listening to me on these podcasts, but 20 years Inspired Hygiene has been doing this work. And I will say that there is no shortage of this work to be done. And if you've listened to the previous podcast episodes in this season, you'll hear a little bit more about that and about some statistics that I shared about, what is really happening and the percentage of patients that are really moving into the care that they need. It's very low. Spoiler alert. But go back and watch listen to a couple of those episodes in this season 2. So today what I want to discuss is share with you the 5 most common obstacles that we hear from dentists when they're considering working with us to help them establish a Perio program. And whether you want to work with Inspired Hygiene, another consulting firm, or do this on your own does not matter in this conversation, because these are things that they're expressing to us because they're coming into their mind as they're considering this piece of their practice. And I'll start with what typically triggers a dentist to begin this journey, or to at least consider making some changes in the hygiene department into their periodontal diagnosis and treatment protocol. One thing that happens, that we have seen happen, is I'll share one quick story that just kind of came to mind. A client that we've worked with recently, they have 4 hygienists in their practice. And unfortunately, one of them had a very significant, very sudden health event. And that hygienist had to be out for an extended period of time, months. It's going on a year at this point. And what they did was, because they had also recently changed some of their participation in insurance, they had some open time in the hygiene department, and they knew that was coming. They have plans to expand hygiene services to fill that. We're actually helping them with that process. But one of the things that they noticed is that hygienist patients were then distributed amongst the other hygienists. And they were really surprised at the amount of disease that was present in that patient base, in that segment of their patient base within their practice. So that is a unique situation that really is an eye-opener for the practice owner to say, oh my gosh, I didn't realize that this was happening, and this was happening under my watch. So that's one example when maybe there's a real sudden event that occurs that makes the practice owner really question their protocols and their clinical systems. Another is maybe a new hygienist joins the team. Maybe you've had the same hygienist for 10, 15, 20 years. Somebody retires, a new hygienist comes in, and all of a sudden they see, hey, doc, I noticed that I'm seeing these patients and they haven't had a perio charting recorded in 5 years or 10 years. This is still happening today, and this is still happening in top tier dental practices. So that is the newbie effect, right? Somebody comes in with fresh eyes and they're taking a look under the hood, so to speak, and they're seeing a lot of things that aren't in place. And I will tell you, as a brand new grad, those aren't always new grads that come into a practice, obviously, but I will say, as a new grad, I remember going into a practice that really didn't have very clear dental hygiene diagnosis systems. Now, this was in 1991. Times are a little bit different then, right? We have a lot more information now and uh, a lot more awareness around what undiagnosed periodontal disease can do as far as overall health. But it's very hard as a new grad to really step up and have a conversation with the owner about maybe some gaps in systems and protocols that they're seeing. Most of the time, those hygienists are just trying to stay afloat. They're trying to finish their patients on time. They're trying to get into the groove of real life clinical practice. And very often they're not going to bring those things up. Very often they're going to just go with the flow and they're going to adapt with whatever process or lack of processes are in the practice. So these are just some examples of when this really comes to light. Another example is the dentist is meeting with their financial advisor that is taking a deep dive, looking into the practice and says, hey, I noticed that your hygiene department, every other part of your practice has grown, but the hygiene department production is stagnant. What's going on? Then they look deeper and they recognize, hey, we see that, Inspired Hygiene and the industry has this benchmark for perio percentage and you're much lower. So those are just some examples of what triggers practice owners very often to call us or to even on their own look at their perio program. So now let's talk about when they're considering that, some things that we hear that come to their mind, whether they're working with us again or not. I mean, let's be clear, like we're Inspired Hygiene. What we do is we help teams implement processes in the hygiene department that create that triple win for the patients, for the team, and for the practice. And if you've listened to the previous episodes in this season, you'll see Perio is it still a number one opportunity for growth in hygiene in many, many, many practices. So let's talk about these common objections for dentists. So I'll just say the first one, and this is very timely right now where we are in the industry, is what if I propose this change and say to my hygienist, hey, I really want us to work together to create a proactive perio diagnosis and treatment protocol system. It's going to start with us doing a much more thorough assessment of all of our patients, making sure we're doing a complete perio charting and recording that at least once a year on all of our patients. And then I want to really look at the research, look at the materials that we can get from the AAP and other resources, and really put together a program so that we're being really proactive. One of the objections is, what if this scares off my hygienist? They don't want the change and they leave. So let's talk about that. Let's unpack that a little bit. So if you have a hygienist, I'm just going to be really blunt in this episode. And there's a lot of hard truths for dental practice owners, for team members, and for hygienists as well. I think you all have maybe seen a theme of that in these Inspired Hygiene podcast episodes. Is we are a group of extremely caring individuals, and we love working with teams that are open. Even the door is a little bit open, right, to growing and expanding their clinical skills and their clinical services. So if a practice owner says, I'm really afraid this hygienist is going to leave, then my next question is, tell me more about that, right? Well, every time we try to implement something new or I ask them to do something different from this particular individual, there's resistance. There's always resistance. There's always a reason not to do it. There's always a reason why that won't work in our practice. Or they're just stuck in their ways. And you know what? They've been here for 25 years. They have a great following. They probably have another 3 to 4 years in them. And I'm just going to ride this out. So my question is for them, remember, you are investing this whole effort of creating this perio program is you're investing in your practice, not just in the team. And what are your core values of your practice? And so then we talk about that. What is the mission of your practice? What do you want for your patients? I want overall health. That's one of our core values. All right. So how is this individual supporting that? And are you sure that they would be resistant? So the question is always, what if they did leave? What would happen then? And we work through that scenario, and we work through the scenario of what if they stayed? What if they stayed and they were re-energized and they were renewed and they took all of those years of experience and they poured them into this new or refined way of caring for patients? How amazing would that be? So I want to give you like some really practical, actionable tips on each of these common objections. One is, what if my hygienist leaves? The first step is to have a conversation, right? Have a conversation. We have a lot of resources on our website where you can get a starting point of where you are with your Perio program right now. And so one of them is our Perio percentage calculator tool. You can go on our website and find that. And if you were to use that and say, hey, I was just looking at all these different pieces of our practice, and I'm really noticing that we're seeing a lot of patients that have bleeding. I've been doing some research on, the oral systemic links, and I just really feel like this is something that we have got to take a look at and refine our Perio program. I ran these numbers, and our Perio program we're doing 10% Perio percentage over all of our hygiene procedures, and the goal is 30%. So I'd like for us to sit down and take a look and just really talk about this. What would this look like? And what do you think is our strong points in hygiene, and where do you think we could improve? It's amazing how often the hygienists want a system and a structure, but yet the conversation has never come up. So my advice for you is, if you feel like you have that hygienist, I would just give them a chance, right? Approach them with this. Say, what would this look like to you if we were to refine our Perio program and really take a more proactive approach? They might say, you know what, I've really wanted to do that, but I'm just not sure how. And I'm nervous of how my patients would feel if we present that. And just have a conversation about it, because you might be surprised. If you're still met with resistance, then you might want to really do some soul searching and figure out if that individual is the right fit for the next phase of your practice. This goes right into another objection, is, what will my patients think? What will our patients think? This is a big one. This is, I would say, it's a top 5 objections when we talk to potential clients about incorporating and helping them develop their Perio program, is, what are our patients going to think? And the reason is because a lot of times we take everything we do very personally in dentistry. It is a very personal experience for the patient, and it's a very personal experience for us as providers, because we get to know these patients. We see them frequently. We're working in a very, intimate space. We're in a close proximity with this patient, literally. And so we care a lot about what our patients think, because that's part of your reputation, right, in your community, and that's part of building your practice. So it is very understandable that a lot of folks are concerned about that. And so what we say is, listen, we give you the tools to address that right off the bat. And I'm going to give you that tool right now. And what we say is, think about, do you want your patients to continue with the same chronic inflammation that they've had for the past 5-10 years? Or do you want to give your patients the opportunity to get healthy? So many times dental practices say, we think of our patients as family, like we're caring for them, we're caring for their family. What are they going to think if all of a sudden now we're presenting periodontal therapy? Well, here's the truth, is 99% of the time, if you see a patient in your chair next week and you've developed a clear standard of care and you have up-leveled your perio protocol, chances are that patient that you're seeing next week that you're going to present treatment to, this is not the first time that they've heard that their gums are bleeding, right? So look back in the notes. We tell hygienists all the time, look back in your notes before you see this patient. What have you talked to them about? What solutions have you given them to overcome this inflammation in the past, short of going through non-surgical therapy or short of being referred to a periodontist? What have you done? Very likely the hygienists have shortened the patient's recall intervals, so they've seen them more frequently. They've recommended power brushes. We're a huge fan of Sonicare, the water flossers, all of those things. You've made recommendations for that. You have had conversations with the patients about their bleeding. You've taught them to floss. You've done all of these things over the years. And if these patients are still coming in with the same chronic inflammation, then their body is not responding to those recommendations the way that you'd hoped. You tried every conservative approach, and if it's still not working, then it's time to do something different. That's the answer. And when we approach patients like that, and when we bring them alongside us in the diagnosis process, then you'll be very surprised how receptive patients can be. So, no, the patients might not accept treatment if you use the same approach that you've always done in the past. But with a new approach that brings them alongside and helps them kind of come up with their own diagnosis. And if you show them the evidence of this is what we've tried in the past, and you still have inflammation and you're still trying to manage your diabetes and having a difficult time with that, it's time to do something different. It's in your best interest to move into this next level of care. The next objection is, I don't want to have to manage this, right? Coming from a dental standpoint, is dentists are managing a lot. As a business owner myself, with lots of moving parts and team members, it is a lot to manage. And not only are you managing, new software, you're managing the compliance that needs to happen. Is a sterilizer being monitored the way that it needs to be? You might not be doing these things every day, but you're ultimately responsible for all of those things, right? Do we have a hygienist this week because somebody called out or someone's on vacation and we can't afford to get deeper in this recare backlog? So all of these things are on your mind. And then, by the way, you're seeing patients all day, every day. So I get it. A lot of times dentists say, yeah, I know we need a new perio protocol or we need to refine the one we have, but I don't have time to create that. And I really don't have time to manage it. And so I will say two things. One is you don't have to create that on your own. There are a lot of resources out there, on our website, on our YouTube channel, in this podcast. You put together all of these different resources. And yes, you could absolutely create that on your own, but you don't have to. There are a lot of coaches like us that work with you to hold your hand as you're doing that. The next piece of it is, do I have to manage this, day to day in my practice? And the answer is, if you're the practice owner and clinical leader, yes, that is part of your responsibility. Is having a coach can help take some of the weight of the accountability and the monitoring of how well these things are staying in place, can take some of that off of your plate. But the day-to-day, is our perio protocol being implemented and practiced on a day-to-day basis? Yes. As a dentist and clinical leader, that is your responsibility. And really, no one can take that off your plate. Now, you can distribute that if you have a hygiene lead. If you have multiple dentists and everybody's on the same page, then you may not be doing that on your own. But that's one of the things that when you're going in there and doing that exam that you're looking for is, hey, we agreed to do a complete periodontal evaluation and charting once a year. Has that been done? And you can say, I'd love to, can you go ahead and bring up the perio chart and just look at that and make sure that's being done and that the team is consistently implementing the standards that you all have agreed to, right? So yes, there is going to be some type of management for that perio protocol to stay in place and stick, but you don't have to do it alone. The next one is, my hygiene team is resistant. So that we kind of touched on that a little bit with, what if my hygienists leave? So you might not be worried about them leaving, but you might be worried about just the difficulty of bringing this type of change into your practice. Because while we don't like to use that term often with teams, anytime you're inserting something different into somebody's workflow, that requires change. It requires behavior change. It requires a mindset change. It requires a change in verbal skills. It often requires a change in the workflow. So, for example, if the hygienist seat the patient and they review the medical history, and in about 5 to 7 minutes, they're scaling, then implementing a very thorough, complete perio program is going to be change in that workflow, right? they're going to be doing something before they pick up that scaler. They're going to be evaluating that patient's periodontal status. And we recommend that happen in that first 20 minutes of that hygiene appointment before we ever start scaling. So that is a workflow change. And so my advice, if you feel like your hygienists are resistant, is again, ask them, what do you see is working really well in our hygiene department? And what do you wish would be better? And very often they'll say, I wish we were all on the same page with Perio, because there are patients that we're treating in a prophy that really need to go into treatment, but I don't know how to code that, what the sequencing is. I'm afraid if I bring that up, doctor, that you're going to not back me up, or I'm not going to be confident in how to treatment plan that, but I know it's something that we need. So then all of a sudden the resistance falls away when you say, what if we could get some help to figure that out? And then they say, yeah, that'd be great, because we've tried to figure this out on our own and it's just too much. So very often that resistance is really just reluctance. It's reluctance because they don't know the answers to all the questions that they have. They might be nervous that you're going to then be looking closer at their work, or looking at maybe some of the insufficiencies in charting and documentation and things in the past. But here's the thing is, say, look, we're going to let the past be in the past. We're just looking at how do we move forward. So let's work on this together. Let's move forward together, because I'm fully committed. This is you as a clinical leader. I'm fully committed to giving our patients the absolute best care. And we have invested in that from the restorative standpoint. It's time to invest in the hygiene department as an integral part of our practice. And I really want to work on this together. So a lot of times your hygienists aren't resistant. They're just reluctant because they have questions. They're not confident yet in how this is going to affect their workflow, and if this refined Perio program is going to fit with their philosophy of care. And a lot of times what we say is focus on the why first. And that is really our approach at Inspired Hygiene when we're working with hygienists, is we're focusing on the why, and the why is best class patient care. And a big part of the why now is that undiagnosed inflammation and periodontal disease is a huge risk factor for patients, particularly if they have other risk factors like high blood pressure, high cholesterol, prediabetes, diabetes, rheumatoid arthritis. You name it, your patients have multiples of these. You see it every day, and you compound that with periodontal inflammation, and it's increasing their risk for significant health events. That is our why, is doing the best we can for patients. And it's not only just about losing teeth, it's really about overall health. So when we approach it that way and we say, hey, let's really get this together because we owe it to our patients and ourselves, then a lot of that resistance honestly falls away. And then the last one that I'll talk about is we don't want to be too aggressive. And there's a fear that going from not treating periodontal disease, or waiting until it's so advanced that it's obvious and they need a referral to the periodontist, that anything more than that is being aggressive and will be seen as aggressive by your patients. You know, I hear stories, and look, we have worked with lots of multi-location groups over our 20 years. We've worked with some sizable DSOs, and there are some that have questionable practices, and then are some that are doing fantastic work, just like single practice locations. So don't throw everybody under the bus, but we hear hey, this person came from the blank, this blank DSO in our town, and they were recommended for 15 sites of Arrestin and 4 quads of scaling and root planning, and we're looking and we think maybe they need 1 quad. Okay, fine. Maybe you're not going to that extent. You're going to really look at your treatment philosophy. But my question is, there's something in between being overly aggressive and being overly passive. And that's where you've got to find your sweet spot. And so what I would encourage you to do is, look on the AAP's website. Look at the staging and grading. It's going to give you good guidance on what is stage 1, what is stage 2, 3, and 4. And you get to decide, hey, we're going to diagnose when this patient has inflammation or active periodontal disease. And we're going to manage it this way if it's very early and it's localized. But when we're seeing that the bone loss is moving to this level, then yes, that's the time that we're going to recommend non-surgical therapy or that. And then at this point is the time that we're going to refer that patient to the periodontist. So you can tailor your refined and elevated perio diagnosis and treatment protocol. You can tailor that to your philosophy. You want this to build on the relationships that you have with your patients. You don't want it to conflict with the relationships that you have with your patients. And I will tell you that every one of these objections we have heard and we have seen our clients overcome very successfully, and surprising themselves at how receptive their patients are, how receptive their team is, and how they are able to transform their hygiene department with really taking a good look at their perio program. So I'll wrap this up by saying we're happy to help you with this. If you'd ever like to just talk about some of these things that have come up for you and you feel like have maybe held you back from implementing a proactive perio approach, if you just want to just talk about it and see if you're on the right track, you're putting this together yourself, just go on our website, book a discovery meeting. We'll even look at a bit of your hygiene data and give you some feedback on that. We'll share with you how we can help. If that's something that's a fit, great. If not, we cheer you on to doing this on your own in your practice as well. But just some good food for thought and some things that may be coming up for you as you're really looking at this piece of your practice. So until next time, stay inspired, and thank you so much for listening. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.